Hi, this is Kari Sheward from the Applied Behavior Center, and today we are at Braces for You with Dr. Mahajan.
That's correct.
I did it! Yay! We are going to talk a lot about dental work, oral hygiene, orthodontia, and this is her Fishers location. She is also going to have a Carmel location. I'll let her talk a little bit more about this, but she has a special tie to the autism community, and we met up a few weeks ago, and just really, I mean, there was a great connection, and she's going to be a wonderful provider for our families, my personal family, and our families that we have at the Applied Behavior Center. So I'm going to let her talk a little bit about this office space, her staff, and what they're doing here that's so special.
Thank you, Kari. Welcome and good morning, everyone who's listening out there. Welcome to Braces for You. I am an orthodontist, and I've been in the dental field since '98. And I graduated from Boston University, after which I practiced for a few years doing general dentistry. I realized my passion was orthodontics, and I went on to do my residency in orthodontics from UNLV, and I've been an orthodontist since 2009. And we spoke about this before, I have been an associate for the past couple of years. And I decided last year that I'm just going to follow my dream and start my own practice. So here we are. We have a little office here in Fishers, and my staff is right here. That's Miss Casara, who's my front desk, and Lisette, who's my assistant here. And welcome to our office. So I will just start off by saying, and we discussed this, how did I get into treating, kids with ASD?
Yes.
So while in my residency, I realized that there weren't very many providers trained, to treat kids, who fall under the spectrum. And my son, who had a little bit of sensory issues, I could not find a provider to extract his tooth, and the options available to me were either general anesthesia or a papoose board, none of which were acceptable. So that got me thinking, like, if this is so difficult to find a general dentist or a pediatric dentist, I'm sure it's the same in orthodontics,
right?
Which is completely true. As we know, ASD or autism spectrum disorder is a really a wide spectrum of disorder. It includes Asperger's syndrome, it includes autism, it includes any other non-specific form that cannot be specified under these two. You have 6 children out of 1,000 kids afflicted with it, and boys are 3 times more prevalent than girls. That's a huge number.
Sure.
And there are not that many providers who will go out there and say, hey, we work with ASD spectrum children, bring them over.
Right.
Very many reasons for that.
I know, and we do dental desensitization programs within our clinical setting, but then to generalize that with, you go to a general dentist and they're not familiar, it just kind of backpedals everything that we work on.
Exactly. There's a lot of resources now out there, Autism Speaks and ABC. You guys are doing a fantastic job. I follow your posts on Facebook.
Thanks.
A lot of information for parents out there. So for orthodontics, I think the main, there's a lot of barriers to orthodontics, if you want me to go into that.
Yes, please.
First of all, obviously, it's the parents and finances.
Sure.
So, they're dealing with a child who is, autistic, and then on top of that, to have to face the burden for, orthodontic treatment, which is not inexpensive.
No, not at all.
Then, the other barrier is, does my child even need it? Why should I even do this? Because the children may not be the perfect candidate, because ASD is a spectrum where the child can be nonverbal to very, very high functioning. So, and then the third barrier is the orthodontic providers who have A, they don't have the training for it, and B, they have, they see 60 to 100 patients a day, and they do not necessarily want to spend the time or the energy that is required for these patients.
Right.
So what we do here, ours is a very small office. What we do here, and I have always had special needs patients, even as in my associateship practice, it's really it's simple. It's you follow a certain strategy, and they're great patients. So we start with a pre-screening, or having the patients come in, and we have a little form that we have them fill in, and I can show that to you. Just kind of that lets us know where the child is on the spectrum. Once we do that, then we talk with the parents, and parents really have to be on board, and moms.
Right.
Oh my goodness, moms! I cannot stress how important having moms on board is with orthodontics.
A lot of those proactive strategies, though, that you're hitting on before they're even coming in and getting services. Just to jump in really quickly, I think oftentimes families see orthodontics as a cosmetic procedure,
Right.
and they're thinking, oh my gosh, we're dealing with all of these other barriers. They can have crooked teeth, but there are reasons why braces and orthodontics are important. Can you share some of those non-cosmetic reasons?
Yeah, fantastic question, Kari. So patients who are on the ASD spectrum, we have seen that they have a lot of class 2 malocclusions, which is where your lower jaw is a little bit behind. They have open bites, they have tongue thrust habits, they have a lot of crowding that is seen. Many times they will have bruxism, or grinding their teeth, lip biting, or they will have food collected in their buccal pouches. So it's not only cosmetic, it is definitely bite related. And even cosmetic wise, why should a child on the ASD spectrum not go forward with their best foot forward?
Sure.
I have seen children who they were nonverbal. We started them, and at the end they had a beautiful smile, and they liked it, even though you may think that they don't understand, or they don't really care, but they do. So I feel definitely educating the parents for the need for these patients to have is to have orthodontics. So once we get the patient in and we determine that yes, he or she will definitely benefit from orthodontics, then we kind of program the treatment around the patient. So for example, some children on the ASD spectrum, they like quiet, and they do not want a lot of stimulation. So we have private rooms where we can see them early in the morning before the rush comes in. So start them there. Longer appointments, an hour-long appointment or 45 minutes, depending on what the patient wants. So I will ask the parent in the form, does he have a comfort thing that he likes, a blanket that he likes to carry, or a toy, or
That's
iPad.
great.
So they can bring that with them. What the parents can do before they even come in is it's called the visual, it's tell, show, do technique, kind of like more visual. They can draw pictures of, and we can provide them pictures of the office.
Nice.
Where they can tell the parents can tell the children that, hey, we'll be going here, and this is what we're going to do stepwise.
That's great. Kind of their own social story.
Exactly. And once they come in, what we normally do is obviously put the braces top and bottom, but starting in phases. Because a lot of these children have sensory issues. They sometimes cannot even tolerate a brush in their mouth. So what we do is maybe place like a few brackets on their teeth in the beginning, see how they do with it. And once they get used to it, then place more brackets. And having the same staff work with the patient. So you have the same assistant, same doctor, same time, same chair. That really, really makes them comfortable.
Yeah, that consistency is great. Would we want to take a
Absolutely.
tour as we're talking about these wonderful places?
Right. So as we come in, it's just, like I said, it's a small office. This is our reception area.
It's so peaceful, and the waterfall's going.
And then we have our X-ray machine here. So we have 3 ops where we actually see patients. We're not seeing patients today, so that's why it's kind of quiet. But there, as you can see, we can even shut the door, kind of a peaceful atmosphere where the child can just be, relaxed. If they want an iPad or if they want a toy, they can just kind of work with that. And they just have their own rooms too. And again, we talk with the parents, we discuss with them before they even come in as to how we can make the visit most comfortable for them.
That's fantastic. Set them up for success.
Exactly. Because a lot of these patients, they're wonderful to work with, and we've had extreme success with patients who have Down syndrome, who have autism, and like I told you, with the moms on board, the beginning is hard, but if you stick with it, I think they do fantastic.
Right. Because there's a lot of maintenance and the brushing of teeth and that sort of thing is important.
Exactly.
Which can sometimes be a struggle in general. So
it is, and then we always provide everything in writing for the parents too.
Nice.
I think parents, moms also, they know their kids the best, so it's kind of like a tripod with the patient, me, and the mom working together.
Absolutely.
So the moms will sometimes tell me, okay, I actually had a patient, and I'll share a quick story. But we put the braces on, and I was like, this is going to be fantastic. It was one of my beginning patients. And he goes back home, and he takes them off. So he comes back in 6 weeks, and we put them back on again. And then he goes back, and he takes them off again. Oh, no. So I was ready to give up. I said, Mom, I think, this was probably not the right choice for them. But Mom, she said, you know what, just stick with me. Give me some more time. And she... what an amazing mom. She went back and she did a lot of positive reinforcement where she, would praise him if he kept his braces on. And then also negative where she would take away his toys, his Xbox, if he broke them. So lo and behold, after a few months, we didn't give up, and the mom didn't give up, and he was fine after that. He actually turned out to be a great patient. He was completely nonverbal. But if I told him to wear his elastics, he would just not. He wouldn't look at me, but he would not. And the result wasn't perfect, but I think it made a big difference. It was an improvement. Yes, great. Absolutely. So I think if moms have, any questions or concerns, feel free to, reach out. Perfect. But we definitely would welcome them here in the practice.
Wonderful. And I know that we've talked about the impressions and how that can sometimes... be very aversive, and there's a different technique that you're looking into. What
absolutely is that? So yes, because of the sensory issues that the patients who are on the ASD spectrum, they do not like, normally what we do is patient comes in, we take impressions or molds of their teeth, which cannot be a very fun experience even for any child or an adult. So there's a new technology wherein we can just scan the teeth. It's a scanner, and we will be implementing that very shortly in our practice. And with that, it's just like taking pictures of your teeth, and it's so easy. You just send it to the lab, and patients love it, and parents love it. It's a very good educational tool as well.
Very good. So you are here now, and you're open on what days?
We are here Mondays and Wednesdays from 9 to 6. And like I told Kari, we're working on our Carmel location, so we will keep you updated on that. But for sure, we are here Monday and Wednesdays.
All right. And we will post after this all the information to get a hold of Braces for You and get your appointment scheduled and get set up. Any questions that you have, if you haven't had an opportunity to post them, feel free to jump on. Mackin, our wonderful marketing man behind the camera, will get those to the office here, and we'll get some answers back for you. Or if you need help connecting, that would be something we could do.
Absolutely. Thank you for this opportunity.
Thank you so much.